You got something in your lungs.
Yes, it's like...
Okay, so lay on your back face up. So we're gonna demo here how to get rid of the common cold. So first we'll take a muscle, bend your knee, resist here. Good. Alright, so there's a functional muscle, and we're gonna testing the rectus femoris here. So resist. Good. Resist. Okay. I want you to breathe in through your nose. Okay. And then we're gonna have you breathe in through your mouth. Good. And so one more time with the nose. Okay. So that means the sinuses are inflamed, usually because there's an infection. Okay, so it could most likely a cold virus.
Okay.
And usually the spleen is a little tender.
Mm-hmm.
Yeah. And the thyroid over here is a little tender.
Mm-hmm.
Okay. On a scale 1 to 10, how tender is that?
7.
And how about here?
6.
Okay. Okay. So if we're gonna go into the sinuses, we're gonna have her breathe this in through the nose. Okay, so I want you to breathe this in. Good. Bend your knee here. Breathe in through the nose. Beautiful. Good. And we'll check the mouth again. Open your mouth. Breathe into the mouth. So this is checking the lungs. Okay. The virus can move. That's pretty good. And I want you to touch in the ear here. So we're going to check the canal, the ear, because the infection can also go in the ear. And check the other side. Here. Nice. Okay. So I'm going to have you, I'm going to drop this in the ear. So just turn your head that way. I'm just going to put a drop in here. Okay.
Oh my gosh.
And so normally we'll let it sit for about 5 minutes. But for demonstration purposes, we're just going to have you let it sit for like maybe a few more seconds, and I'll have you just put your hand here and just let it out onto your hand. Okay?
Okay.
Yeah, so it's just water with some silver in it. You can let it out. Yeah. Okay, perfect. That's good.
Okay.
So just a little background on colloidal silver. Colloidal silver is kind of the same idea of like silverware. So if you think about back in the day, there was kings and queens, and they would eat with silverware because it would kill off the bacteria. So that's just the property of silver. But they also found that it kills off other pathogens, including viruses. And so there was a study done in the 1920s on the flu, and they found that the patients that had the flu, some were treated in the ear with actually hydrogen peroxide food grade. They put it in the ear, both sides, and let it sit for about 10 minutes. And then about in 12 hours, all the symptoms resolved. So all those patients that got it, they resolved, and the other ones stayed sick. And so then there was a clinical paper done, probably in the 80s or so. I can't remember the exact date, and it said use colloidal silver instead. And so I've been using it in my clinic and getting amazing results. And so we're gonna find out right now.
Okay.
Okay. So go and touch the ear again. Bend your knee here and push. Sweet. Okay. So take that off, and then tell me how this feels.
A lot better.
What's the tenderness now?
Like a 2.
Okay, good. And how about over here?
Yeah, a 2.
Okay.
Wow.
So you can see how quickly it works. It works very rapidly. So this is colloidal silver. It's actually 10 parts per million. Oh no, this is 120 parts per million. Normally, if you go to Whole Foods, they sell 10 parts per million. So I found it's better to go with a stronger dosage. That way you're not spraying a whole bunch and like having to do it all day. You just have to do it like maybe once a day for 3 days, and then it'll be gone completely.
Wow.
That rad?
Yeah, that's rad.
Okay. All right, then you need, we'll check, one more thing to check is the throat, so swallow for me. Yeah, see, so the throat's also, so yeah, so we're gonna drop a little bit of this in there. Just, good, swallow that. And then also the skin absorbs, so I can just spray right over the throat. And just rub that in. Good, bend your knee here, and if you can swallow. Okay, good. Yeah, so now your body's not gonna have to produce all that phlegm to fight off the infection. So it's gonna resolve, and you're gonna feel way better.
I love it.
Okay, awesome.